And you can use a 30-day window. And also the other thing about the cans in particular is it's been designed, it can be used for level of care determination. So it's also an outcome measuring used for level of care. So the cans is what we call a communiometric tool. It does have traditional psychometrics that are good, but it also is really based on the capacity to communicate results and findings. And so when I came in to EMQ Families First, and the agency, like many agencies and counties, had the CBCL in place, the CAVAS in place, and then a whole bunch of measures linked to evidence-based practices. One of the questions we have is, what do we pick? I mean, do we stay with what we've been doing or do we evolve? And we chose the CANs. And we chose it because it allows us to integrate perspectives. You get one score. It integrates the clinician, parent, child, and other perspectives. You don't have to reconcile different perspectives. You do that as part of the scoring process. It communicates in understandable language. Our clinicians like the CANs because if something is actionable, that means something to them. It means that they have to do something about it and it should be a part of the treatment plan. They don't have to decide is sometimes something that has to be actionable or not. They decide that as part of the measurement. It focuses on symptoms versus diagnosis, which is fine. It prioritizes your risks and your actionable concerns and identifies your strengths so you can build things from it. It's also based around real-world reference. So it looks at in-home, in-school, out of trouble, risk, and it also captures things about the caregiver, which is important. So it integrates these perspectives very nicely. One other thing I want to kind of mention about this is that you'll hear a lot about quality of life. I think one of our speakers, or maybe others, mentioned it. This is probably an important construct. It's been going on. I used to do a lot of health services research too when I ran fleeing from the mental health world for a while. And I'm not sure why I'm back. But anyways, and one of the things that you look at in healthcare, of course, is quality of life, because so much of healthcare is based around quality of life. You know, what a knee injury means is very different to, say, me compared to someone who's going to be a middle linebacker for the Atlanta Falcons, just to pick a thing I would love to be that I can't. And so, you know, these things are very different. They're subjective, and quality of life becomes very important because your functioning is largely a subjective thing. And generally, quality of life is a combination of objective things and subjective things. So in healthcare, you have, you know, how far can you move your knee, and then how much does it actually hinder your lifestyle? And that's a very common way of measuring things. And I think increasingly we'll see, at least in children's mental health, I don't know about adults because I don't know much about it, a lot of emphasis on these quality of life, where you can combine objective indicators with subjective ones. And this slide just gives you an example of how you can do that with the CANs, where you can have the actual living environment, and then you can get at the living situation, the family, and the residential stability as the subjective indicators. And so all of these things kind of can map over with the CANs, which is one other just advantage of it. We use, by the way, just so you know, historically these objective indicators were done in California. We tried to do them over many years by using information systems. And I think it's safe to say, I see a smile in the audience, that wasn't a good idea. Because the information systems were so complicated. I don't know how much better they've gotten or not, but especially when you get into things like school, where information is kept at a district level, juvenile probation, where it's kept at a county level. It was so hard to merge these information systems. So we actually, at EMQ, just have a simple 12-item thing, and our clinicians fill it out to their best capacity, and we're pretty clear that it's reasonably reliable, it's easy, and it works. So we do look at living situation, residential stability, school attendance, juvenile justice, and we complete them along with the CANs, so we get our objective and subjective indicators. I can tell you, a year into our experience, or about a year and a half, 2 years, I'm not sure exactly. 2 years, thank you. Our chief operating officer knows all. 2 years into our experience, after some challenges in doing this at first, we're actually collecting this without much problem, and it's really actually very nice because I get to walk into clinical settings and not have people throw things at me, which is my prior experience. Also, the CANs, just so you know, is being used in many other places. It has statewide usage, in the following purple states, which I guess means a combination of blue and red. In the following purple states, and that's, I think, 16 total now, have statewide implementations either in social service or mental health. In one state, it's actually juvenile justice. And then there are a number of states, including California, with the CANs presence. We have several counties in California currently that mandate the CANs. And there's also, for those of you who are thinking of fleeing the country, depending what happens in November, There is also provinces in cans with cans, and I'm actually going to Toronto in a couple of weeks to, just in case, to do some consulting, but also just in case. So there's a lot of, I was talking to Massachusetts, for example, where they've now done 250,000 cans since the passage of their Romney Care. Essentially, the cans became part of their mental health system. So it's very widely used, so we can also talk about that. So just as one example, we have found the cans very, very useful in our agency. Other places have found it useful, and it represents some evolution. One last thing about it, the cans, because of the way it's designed, can be tailored and customed. You don't have to leave it in its perfect state. That kind of makes some things challenging because you get a bunch of different kinds of cans and versions, and if you're trying to combine things. But it also allows, for example, if California chooses to go this way, California to have basically their own custom version or core sets of the cans that can be more limited, and then counties can add other things as well. So there's a lot of different ways to work with the measure because you can build it from the item level up. Okay.